Hello everyone, my name is Muhammad Fahmi bin Osman, number matric 1910933383FSL. Today, I would like to explain related to the topic of mental health for the subject UVW 201, English for General Communication. So, for the first explanation, I will explain what is mental health. Mental health, defined by the World Health Organization (WHO), is a state of well-being in which the individual realizes of or her own abilities, can cope with the normal stress of life, can work productively and fruitfully, and is able to make a contribution to his or her community. The three core components of this definition are 1. Well-being, 2. Effective functioning of an individual, and 3. Effective functioning for a community. According to the WHO, mental health includes subjective well-being, possessive self-efficacy, autonomy, competence, integrational defense, and self-actualization of one intellectual and emotional potential. Among others, from the perspective of positive psychology or of holism, mental health may include an individual ability to enjoy life and to create a balance between life activity and effort to achieve psychology resilience. Cultural difference, subjective assessment, and competing professional theories all affect how one defines mental health. Thank you.
Thanks a lot for me for explaining what is mental health, and I Amiro will continue to the factor of bad mental health. First of all, is family breakup or loss, separation or divorce, or loss of parent or sibling is extremely painful. Finding ways to cope and adjust to the changes wrought by these events is critical for everyone, but particularly for youth. How grief is handled can affect young people negatively for years to come. If children are having difficulty coping, professional help is recommended. What I mean is that you need to take your kid to see a therapist. My second point is difficult behavior. When people are unhappy, they either initialize their unhappiness to act out. They later usually appears as bad or difficult behavior, such as using abusive language, being aggressive or violent, damaging property, stealing, lying, refusing to comply with request expectation at school or home, and they all displaying other inappropriate action. If such behavior is serious as persistent, the young person and his or her family might require professional help. My third factor of bad mental health is physical ill health. Disease, injuries, and other physical problems often contribute to poor mental health, and sometimes mental illness. Some physical causes from birth trauma, brain injury, or drug abuse can directly affect brain chemistry and contribute to mental illness. More commonly, poor and physical health can affect the self-esteem and people's ability to meet their goals, which lead to unhappiness or even depression. In such case, receiving the best possible treatment of the both physical and the resulting physiological consequence is the key of optimal recovery to good mental health. Lastly, abuse. The mental health of the abused children is at great risk. Abused children are more likely to experience mental disorder or mental illness during childhood and into adulthood. Abuse may be physical, sexual, physiological, or verbal. It may not always be evident or easily recognized. Regardless of the form it takes, abuse cannot be tolerated. Children need to be protected from abuse and help to overcome negative effect. Abuse can cause feeling of low esteem, lack of confidence, depression, isolation, and anger. Trust in others and feelings of being safe and cared for key components to recovery for abuse. Few children are able to recover on their own. Support is critical and professional. I think that's all for me. That's all for me. Thank you.
Hi, Assalamualaikum. My name is Muhammad Khairi bin Zamri, metric number 19109333X4FXL. Okay, so for my part is opinion about the mental health issue. We focus about the youngster to suffer from mental health issue. For me nowadays, youngsters suffer from mental health because have a lot homework. So the youngster becomes stressed themselves. It is happen because the youngster can arrange their time properly. So they must have their own timetable of their daily activity and must follow the schedule. Secondly, the suffer mental illness because of family problem. One of the problem is don't have strong financial or economic problem, so they feel hard to survive their life and from that will cause of conflict in family. So the effect children feel stress in their self and feel not happy have in own family. Lastly, bullying symptom at school or activity or university also can cause mental illness to the youngster nowadays. Because of that, bully victim will face trauma to face with community. Because they feel everyone wants to bully them, so it will give effect to the mental of bully victim. Then for the conclusion is mental illness like in many part of the world is an emerging issue in the country and should be taken seriously, said consultant psychology or physiatrist at University Malaya Specialist Center UMSC, Associate Professor Dr. Ng Chong Guan. However, due to insufficient number of physiatrists, there is not much avenue for those with mental issue. The number of physiatrists in Malaysia until March 2017 was only 361, namely from the Ministry of Health 207, Public University 84, Private University 22, Armed Force 5 and Private Sector 63. He said the normal physiatrist to population ratio is 1 per 10,000, but in Malaysia the ratio is 1 to 100,000. And what is more worrying is that the disease is also affecting more youngsters. This problem now has become more complex because it's may related to drug, bullying and some other issues. Compare previously when anxiety of stress was the main cause. He said, pointing to the rise in the number of youngsters with the problem, thought the problem could be treated at least within 6 months by undergoing proper treatment. There is also risk of the condition worsening or reaching serious level when not addressed accordingly. Therefore, Ng, Dr. Ng underscore the significance of the efforts to educate the society on early recognition of mental illness as well as enabling them to take care of their own mental health. Most people with mental disorder realize they have some sort of abnormality inside them, but they just take painkiller rather than going for proper assessment and seek treatment for psychiatrist. He elaborated. Dr. Ng said psychiatrist care serve were available in government and private hospitals as well as private and non-government organisations such as the Malaysian Mental Health Association (MMHA). The private hospital where psychiatric care service and available include Hospital Bahagia, Hospital Permai, Hospital Mesra and Hospital Sentosa. Okay, that's all. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Faisal bin Abdul Jalil. Number matric 191008337 FSL. Today I'm gonna talk about how to boost your mental health care. Okay, first, track gratitude and achievement with a journal. You can include 3 things that you were grateful for and 3 things that you can accomplish each day. For the second point is start your day with a cup of coffee. Why coffee? Coffee consumption is linked to the lower rate of depression. If you can't drink coffee due to the caffeine, you can try another good drink for you, which is green tea. Last but not least, you can boost your mental health care by set up a gateway. It could be camping with friends or trip to the tropic. A habit of planning vacation or having something you can look up for can boost your happiness for 8 days. That's all from me. Thank you.
Assalamualaikum and good morning. My name is Zawawi bin Muhammad. My TIN number 191093389FLX. Today I want to explain mental health issues started in Malaysia. Mental health issue among Malaysia young. In 2088, there are about 5.5 million adolescents in Malaysia. 1 in 5 depressed, 2 in 5 ignorance, 1 in 10 stressed. The graph show the suicidal behavior by state. Suicidal area height in Kuala Lumpur 11.2%. Suicidal blind height in Selangor 9.0%. Suicidal active height in Perak 10.1%. By year, adolescent succeeded behave a grow problem. In case succeeded behave idea and plan and attempt for 2012 to 2000 2000 770. The ideal 2012 7.9%. The plan 2012 6.4%. 2012 for attempt and 6.8%. 2018 the ideal 10.0% to plan 7.3%, and to attempt 6.9%. The graph show to girl and boy. Girl more like to consider succeeded, but boy more likely to attempt it. For the ideal, this girl 10.8%. The plan for girl 7.8%, and the attempt for girl 6.9%. Boy, the graph show to ideal 9.1%. Boy for plan 6.8%, and for attempt this boy 7.0%. The peer and family support less than half of the adolescent is perceive that the parent know what they will do in the free time. 1 in 3 adolescents present that the parent understood the problem. Less than half of adolescent and peer support at school. Succeeded ideal height amount for one student. Ideal thing 11.2%. Plan 9.0%. Attempt 10.1%. This graph I take the Malaysia have 7 or Malaysia have Ministry Institute for Public Health 2018. Okay, terima kasih. Assalamualaikum.